I want to really park here just for a minute. This is also in the standards, and this is a very great figure to know and to really kind of print off. This is our decision tree for glycemic management. And if you notice, it's a cycle, meaning, and it's not linear, meaning there's not a stop and a start. It's a continuous cycle, and people can cycle in and out. And so I want to just quickly go over like the high points of this. As we do with everything, we start out with assessment, just our patient characteristics. And so this is what our clinical picture would be like. This is our demographics and getting our assessment. And then we go into the more specific factors. So clearly, our A1C is really going to guide how we go about what treatment. A treatment of 6.3, which would be considered prediabetes, is different from 10. 7 is different from 10, and so our A1C really guides our care, but we're also looking at complexity of regimen. I currently work in a role of community health, and I see so many elderly patients that have so many complex regimens. They have multiple insulin injections, multiple pills that they take a day. If there is an opportunity for us to simplify the regimen, those are the things that we're considering when we're starting our management plan. Shared decision making, we're going to talk about that later and go more into detail with that. But the shared decision making not only happens with your patient, but it also happens with your patient care team and the day-to-day care team that helps the patient, from the MA to the front office to the lab. Really what is appropriate for the patient and allowing the patient's needs to guide that for you. And then we're setting goals. We're really helping our patients. These are not our goals. These are our patients' goals. Now, many people don't know how to effectively set goals. Hence why SMART goals is a very easy and effective way. You have specific, measurable, achievable, realistic, and time-bound goals. This is something that is very easy to teach to our patients, and we can see what is important to them. And from all of the information that we have gathered, we then go and implement a management plan. You typically do want to follow up in about 3 months with that when you're starting something new. Give it enough time to get working and then to be able to evaluate. Of course, we're going to provide ongoing monitoring and support, for the patient. Even if there is opportunity to automate things, that would be very helpful. And then, of course, we're going to review and we're going to evaluate our plan and see what's working, what's not.